Botox itself is going to actually diffuse in, if I'm using the 2 cc dilution, it's going to diffuse about a centimeter around where we're putting it. So if you think about here, it's going to diffuse probably about that much. So it'll capture most of this complex. If we put it in this area, it's going to diffuse about that much. All right, turn to the side. I want you to make squint. Alrighty. She doesn't really have a lot going on the side here, so I could actually do just, you know, maybe about 5 units or even just 3 units to kind of get here. So I'll probably just do 5 units right here. And hers aren't really pronounced, so I'm going to just put little dots in that area. You want to stay at least a centimeter away from your orbital rim. Again, here we want to be at least a centimeter from the rim, not the brow. So it's kind of helpful sometimes to put your finger on that to remind yourself with that. And you also want to stay medial of that midline. So be aware of the midline, be aware of the centimeter here, be aware of the centimeter here. Okay? And that'll usually keep you out of trouble. If you lift your brow, we're also going to want to stay on the top part of the forehead. And for her, relax. Since it's one band, I'm going to want to make sure that I do get some in the center so that I don't have a persistent line there. But I'm also going to stay high up, but more medial for her here, because I do want to get a little lifting here. If I want to get a lateral lift, where we were talking about the temporal fusion line, I want you to lift your brow. You see where hers start to change here. Okay, relax. So I'm going to actually put a little bit here, and since hers is more down, I want to make sure that I'm not going into the orbit. This is probably the one difference in the rules, because we actually are a little bit closer here because we are trying to weaken the depressor and allowing for this to pull up unopposed.